Hello, I'm Elizabeth, better known as Lissa Barker, and I have been a fellow since 2001, so I was in the second group. During the time that I was first inducted as a fellow, I was a captain in the United States Navy. One of the things that I have always loved about my career, 36 years worth in the Navy, was the wonderful mentoring that I got. And especially thinking about the time when I got orders to be the executive officer at Beaufort Naval Hospital. And I got there, and that first night that I was there, there was a boat that was going down the Beaufort River. They were having a party, and they invited me to go. And that was the first time I actually saw the hospital. And I absolutely panicked because I thought, I'm not sure I can do this. What do I do? Well, I got on the phone with Admiral Hall, who had been my mentor for some time, and she smiled sweetly and said, "Stop your whining, Barker. Just go do it. You've got it." Well, I laugh about that now because I think one of the things to remember is that you're never too old for mentorship. I was well in my career, but Admiral Hall had been a wonderful person to teach me how to be authentic and how to do the kinds of jobs that I needed to do, not just as a nurse practitioner, but also as an officer. As I got interested in this whole issue of mentoring, I really went to look at what that meant. And I wanted to share today some of the core elements of mentoring. It's a formal, dyadic relationship. It's between two people. There are some folks that say that you can mentor many people at the same time. I think that's a very difficult thing, and I certainly don't recommend group mentorships because everyone has different levels of learning needs whenever they are in that relationship. One of the huge hallmarks of a good mentoring relationship is mutual respect. And that mutual respect is reflected in the fact that the mentoring times when you are in conversation with your mentor, it's a really safe place for discussion and growth and receiving feedback without fear, receiving feedback with the eye to learning. Almost all the time when you are in a mentoring relationship, there are roadblocks of some sort. Whether or not those roadblocks are because of the project that you're working on or the communication is not really that good, one of the big, wonderful hallmarks of mentoring relationship is that navigation of those roadblocks is something that is discussed. Most often, the best way to do that is for the mentor to ask the mentee some really specific questions. In my discussions with people about mentoring, I find that often they confuse the concepts of coaching, precepting, supervising, and mentoring. As we've said, mentoring is a dyadic relationship, and it is specific to a growth that a mentee wants to do. Precepting, on the other hand, is a time-limited kind of relationship where a specific skill set is being practiced. It may not be one-to-one, and it's most often the application of that skill set to a role, usually a new role, such as precepting students in a nurse practitioner program. Coaching is a wonderful technique, but coaching does not really have to be in the realm of professional development. And so the relationship that you have with your coach doesn't really need to be in a professional way as is a mentor relationship. Supervising is evaluation. It is not necessarily dyadic, and its major piece, I think, is protection of the patient from procedural mistakes. In other words, your supervisor is the person who makes sure that you're doing it right. And that's a little bit different than precepting because oftentimes the supervisor may have more than one person to work with and, in fact, may not actually be part of the educational system. Well, what are the big pluses of a mentor. What makes a good mentor? One is that the mentor offers and recommends elements for growth. This is done in a collegial, growth-producing, never a punitive way. A great mentor knows how to work within generational differences. And one of the things that's really important for us to remember is that in nursing, we have 5 different generational groups who are now still active in nursing. And it's important for those of us who are mentors to be familiar with the various characteristics of the various generational groups. I'm not saying that everyone is the same, but I am saying that the way in which people receive and give feedback is often different depending on where they are in their generational group. A good mentor is honest and genuine and caring. Those, I think, are 3 of the most important qualities. Another really important quality is that a mentor values the two-way street of learning. I have mentored many, many young nurses, or older nurses for that matter, and I have to say that I have almost always, no, strike that, I have always learned a great deal from that relationship. And it's stuff that I didn't even know I didn't know, or I didn't know that I needed to know. And so I would really stress that when you're thinking about becoming a mentor, you have to look at how you receive the honest and genuine feedback from your mentee and value that two-way street of learning. Mentees, the really great mentees, first of all, they are seekers. They're seekers of growth. They have a particular area in which they want to become expert, or even if not at the expert level, they want to become competent. It is a characteristic of mentees that they are passionate about what they want to do. And if they're not passionate about what they want to do, that's a roadblock with which the mentee and the mentor have to deal. I also think that it's important for the mentee to receive suggestions from the mentor without rancor or without a feeling of being put down. I believe that we all learn when we get suggestions to help us look at something with a different lens, and that's really, really important. I think the mentee has to be committed to the process and has to understand that it's going to take time to do, and doesn't expect the mentor to solve problems, because the mentor probably spends more time asking the mentee questions about where they want to go, or how their objectives might be revised, or what they expect as the outcome, how do they expect to get there, than saying, okay, sweetie, here's how you do it. And that's one of the differences. Oh, you would never call anybody sweetie. That's nasty. Don't do that. I think that one of the things that you want to do is to make sure that you, in mentoring, are asking the questions, asking the patient or the student or the mentee to do what we call in academics the diagnostic reasoning, to be able to get through and really think questions through. And you guide them, but you don't give them the answer. I want to tell you that being a mentor is probably one of the most growth-producing and rewarding things I have ever done. And I really I believe with all my heart that when you are doing a good job mentoring, you're paying it forward. Remember that as I'm a family nurse practitioner, and I always try to remember that my middle name is Nurse, so that I am really concerned about improving patient outcomes. And as a mentor, I help mentees improve patient outcomes no matter what the project is. So when you're mentoring and you're doing it well, you're paying it forward. And the best thing that can happen is when your mentee shines and actually goes beyond you. So give it a try. And if you have questions, please let me know. My name is Lissa Barker, and my email is barker.203@osu.edu, and I'd love to hear from you. Thanks so much.